When the H7N9 bird flu virus first introduced itself in China last year, officials didn't think much of it. But 6 months later, it's getting a lot of attention, especially as the world's busiest migration period, the Chinese New Year that is, approaches. It's been virtually daily news coverage in Chinese media of the disease as more and more human victims are reported. We begin with Xinhua's report. China has banned live fowl trading in some areas. This after more human H7N9 infections and deaths have been reported in several provinces. The Chinese Center for Disease Control and Prevention says the bird flu has killed 20 in China this year, and the number of human infections has reached 96. Live poultry trading was halted in Hangzhou, Ningbo, and Jinhua cities in Zhejiang province, which has reported 49 human H7N9 infections, including 12 deaths this year. The province has launched emergency surveillance of poultry farms, in addition to halting the flying of domestic pigeons. Shanghai says it will halt live poultry trading from January 31st to April 30th this year. The city has reported 8 human H7N9 infections in January, 4 of whom died, including 1 doctor. Guangdong province reported 26 new H7N9 cases and 4 deaths so far in January. Hong Kong's health authority has also confirmed an H7N9 case at the local agricultural market and will cull about 20,000 birds in the market. Now, other provinces such as Jiangsu, Fujian, and Hunan also reported new H7N9 cases. The Shanghai Daily gave a more reassuring, if confusing, tone. Xu Yueleng, the director of the Chinese National Influenza Center, said a large-scale H7N9 epidemic is unlikely during the Spring Festival holiday, as no H7N9 virus mutation that could affect public health has been identified so far. Xu adds that H7N9 is more prone to human infection than H5N1, with the H7N9 case fatality rate reaching 20 to 30%. It is not clear whether the rise in reported cases is due to the virus becoming more widespread and possibly less severe, or if detection and treatment has improved. Cases and deaths dropped significantly after the end of June, but have begun to pick up with the onset of winter. But there's an admission that the H7N9 is more contagious. Now, the Beijing News' version included the drug that's a known cure. Xu said that the virus is sensitive to drugs such as Tamiflu. Xu encourages doctors to use more Tamiflu when treating patients with H7N9. The expert said this is especially true for groups who have a high risk of dying from the virus, such as the elderly and pregnant women. Speaking of whether the virus will live longer after they get used to the antiviral drugs, Xu said that even if you don't use these drugs, it will still develop a resistance to any drug. Xu also said that the current virus is the same one as the one in April last year. Xu added there aren't any new strains that are of public health significance. Well, it would certainly be tragic if the virus spreads like wildfire during the holiday season. We pray it doesn't.